up. I'm going to take my scissors and I'm going to put it down where the cloaca would be, the opening, the shared passage for both the digestive system as well as the reproductive system, and you're just going to kind of pop the scissors right through the tissue. I'm trying to pull the skin up a little bit, and you should feel it's going to give as it goes through the skin, and then you want to pull back a little bit so you don't cut into the muscle layer directly below. You can kind of see me holding the skin and trying to pry it up with my finger, and you're just going to cut with the tip of your scissors aimed up. You want to cut up as far as you can up here, and then you're going to cut towards the side, and you're going to do the other side. And again, you want to make sure to lift the skin up as you cut so you don't cut into the muscle layer. And we're going to do the same thing down by the hind legs. It's going to be kind of like a little jacket. It's going to be able to open up. And if you look closely, you can see the frog's abs. So you've got the abdominal muscles here.
You can probably see a few blood vessels in the skin right now because the skin is so thin. Notice how thin it is. It's very permeable to gases because we did talk about how the skin can be used for gas exchange in amphibians.
Once you've observed the blood vessels in the skin as well as the muscles, you're going to cut a little bit deeper, and you're going to pierce into the muscles and into the abdominal cavity. And again, you're going to feel it go through, and then it's going to give a little. As you hit the abdominal cavity, you want to pull your scissors back out a little bit and try to aim upwards so that you don't cut into the large intestines and the other viscera in the body cavity, the other organs. Some fluid might come out, and that's just going to be the preservatives that the frog has been sitting in. And again, we're going to do the cut to the side. Make sure to lift up. The heart's going to be in this region. You can kind of hear me snipping through the bones, so you're going to need a little more pressure there. I like to cut as far to the side as I can because it just opens it up, and you can see all of the organs in the abdominal cavity all the way to the dorsal side. If you look closely, you can see as I cut this, there's some spider-like tissue. It's kind of white, looks a little bit like saran wrap. That's the peritoneum. You're also going to want to cut a little farther up through the sternum here, so you're going to be cutting through bone, so you're going to be able to view the heart. You may hear kind of the bone as I cut here. And again, get your scissors in and aim up.